Okay, everybody. Thank you all for being here. I'd like to call the meeting of the Human Services Committee to order. And a physical quorum of the members is physically present. I will entertain a motion to permit those members not physically present due to personal illness, disability, employment purposes, or for the business of the board or family or other emergency to participate by video or teleconference. I had a motion by member LaPlante.
Second.
And the second by somebody. All in favor, say aye.
Aye.
Okay, thank you. Welcome, member Desart. Do we have any public comment?
No public comment.
Oh, roll call, yes. Karen.
Chair Swarzy.
Here.
Member Cahill.
Here.
Member Garcia.
Here.
Member Desart. She's six. Member Desart.
Here.
Member Galassi.
Here.
Member LaPlante.
Here.
Okay. And we do not have public comments, so my only comment is I'm shocked that there's this many people here to support the acceptance and appropriation of the IACA Employment Barrier Reduction Program.
They care deeply.
Yeah,
we do. Very popular.
Anyway, so no other comments by me. Just thank you for all being here. It's gonna show it shows how appreciated our staff is. So, and we'll talk about them in just a second. Do any of the members have any comments? Okay, seeing none, I will take a motion to approve the minutes, item 25-2391 from the Human Services Committee from our regular meeting, September 2nd, 2025. Any discussion? All in favor, say aye.
Aye.
Opposed? Okay. So we have some length of service award recognitions, which is just awesome. And thank you for all for being here. Our first one will go to Sunitha Doma, who has served 10 years in our community service departments. I'll turn it over to Mary.
Well, believe it or not, this is only about a third of the senior services staff.
Wow.
Yeah, but I think the turnout today really shows how, what a team atmosphere the managers and seniors have created, and people really support their coworkers. I really appreciate that. So September and October of 2015 was obviously, we were doing some great hiring then. We're always doing great hiring, but it was a particularly strong couple of weeks. First up is Sunitha, who works in our Choices program. I'm gonna let Natasha say a little bit, and then we're gonna turn it over to Jeannie.
Well, we just want to thank Sunitha for 10 years with us. We truly appreciate all the hard work you've done for us. And we're just so excited that everybody here is here to kind of support you today. So congrats on your 10 years.
Thanks.
Oh, yes, yeah. Sorry.
So Sunitha originally started over in Gina's unit. And then she came over to seniors in July of 2017, and then she stayed in as a CML until April of 2022. And then we got Sunitha into our program, the Choices for Care program. She started as one of our community staff and then took over at Hinsdale Hospital. Sunitha lost her husband in December of 2023, and then she came back and took over at Good Sam, and she's been our lead there. And Sunitha's sense of humor is incredible. I mean, she literally is one of the funniest people, and she makes everybody laugh. She makes working with her so much fun. She's so warm and welcoming. The community staff rotate in at the hospitals to help. The Choices staff do around between 10,000 and 11,000 screenings a year. So it's a very busy job, and thank you so much we are so blessed. And I joke that the CCP managers always say they're going to take her back, and I say she's mine. So yes, I'm so blessed to have you. So thank you so much for all. Thank you.
Yes.
Go ahead, take one.
Good morning, everyone.
Good morning.
Thank you for hiring me and believing in me. I started as an INR specialist in 2015, learned about the programs and guidelines, and then moved to senior services as a CML 2017. Then to case manager in 2022. I would like to acknowledge my managers and coworkers who played a huge role. Gina and Lisa Hamilton, thank you for hiring me. And my first manager, Kristen Ritchie, thank you, thank you. And Sue Makowski and Jeannie, thank you. Julie Larson, my first CCP trainer, and she trained me forever for CCP. It's like a bachelor's degree. I passed. I got A+. And my coordinator, Elisa, thank you. She's always my friend and my sister and my coworker, my coordinator. Thank you so much, Elisa. And thank you for your support and kindness. My coworkers, both INO and seniors, helped me too, and I'm able to get this far. My lunch table, also known as fabulous, fantastic table, we call them as F table. And when I joined here in county, my daughter Cynthia was going into 7th grade. My son Mark was going to 3rd grade. Now Cynthia, a college graduate, waiting to get med school, and my son is a freshman in College of DuPage, majoring in nursing. My husband passed 2023, December 22nd. Entire county supported me and stood by my side. Special thanks to Mary Keating and Natasha. Thank you, everyone.
Thank you, Sunita. What we're gonna do is we're gonna recognize all service awards. And then afterwards, we'll all say a few words and then we'll do a picture with all of you. If that's okay. So thank you very much. Now we're on to Christy Place-Iltang. So Mary, I'll turn it over to you.
All right. Another one from the Choices Program?
Yes. Christy, we just want to thank you for your 10 years. You have been so helpful to the Choices Program. All of the, I know, forms that Jeannie kind of sends your way to kind of fix for us. Kind of our guru of fixing Choices forms. But thank you for your 10 years and your dedication with us. We're so excited for you.
So Christy originally started in billing, and then she was catting the choices assessments, and then she moved into the MCO position, which are managed care organizations, lots of assessments, lots of staff that flip between a managed care organization, and then they flip back to the community care program. In July of 2019, she joined the Choices for Care program, and so she's my admin specialist, where she really just handles so much for me, and I cannot thank her enough. We have a general email box that all the nursing facilities in DuPage County and the assisted living and supportive living facilities email in questions, request paperwork, whatever. She handles all that. And so when she's off, I'm always like, please come back. And she's extremely talented and she wins all kinds of contests for her sewing. And so she's been to Japan and France and just where else? Germany.
Too. Only for 2 hours.
Okay.
Japan, Ireland, and Portugal. I'm trying for France this year.
No. No. I don't mean to say no, that she can't, but anyways, Natasha's correct. I volunteer Christy all the time to make spreadsheets for any of the managers. Christy is one of those crazy people that loves spreadsheets. She truly does. And she loves fixing forms. She loves taking over things. And I know. So Craig, I always contact Christy first before I contact IT because she is our guru in choices. If we have computer issues, IT tries to get her to come and work for that, but they say no, she's mine. So I make all my staff safe. So, but thank you so much for joining Choices. We're very blessed to have you and we love you.
Christie, you'd like to say a few words?
Yeah, I just want to say thank you so much. I really, really appreciate this. I didn't prepare a wonderful speech like I needed to. But I do want to say thank you. I absolutely love working with Choices. I love supporting my team. I have a really unhealthy obsession with my spreadsheets. But just, I really, really enjoy the supportive atmosphere and everything that Choices provides, and it just means a lot to me. Thank you so much.
Thank you very much. Now, Karina Vasquez.
Thanks for highlighting Karina, who works in our ombudsman program. The ombudsman program, if you're unaware, does regular presence in all of the long-term care facilities, assisted living. It's our staff as well as some volunteers. Really essential program, and we appreciate your tenure.
Well, thanks, Karina, for 10 years with us. I know Ombudsman, you've been here since I kind of moved over. Karina kind of moved into the Ombudsman program, which was what I did for a long time before I became the administrator. But we're just so excited that you are part of our team, been here with us for 10 years, and we want to just thank you for your dedication. Thank you.
Started in INA, out in reception as a CSA for a while. And then she moved into INA, where she did a little bit of help with the LIHEAP applications and worked there for a little while. Then in INA and INR, she then worked with taking ombudsman and APS referral or calls and cases. And she loved the ombudsman work so much. She came over to join us, where she's been for the last 6 years. And she is an amazing coworker. She does amazing things with her colleagues in terms of taking on extra cases. Oh, girls, what do you need? I love that phrase. You're like, girls, what do you need? I can help you out. So she does that. One of the things that really sticks out for Karina, for me, is that she's a staunch advocate for her residents. She will fight for them to make sure that their voices are raised and heard. And one, I have to give this example. One example is when we often have to make sure that the residents are heard to surveyors and IDPH surveyors that come into the buildings. And one time she had the occasion, she knew the surveyors were coming in, and I'm sorry, not the surveyors. This is the one where you had a complaint about the temperature, and she got and then nobody was listening to you. Nobody was listening to her, that the temperatures in the rooms were very hot, and she needed to make sure that people heard this. So she got the maintenance director and took him room to room and had him take his little thing to measure the temperature in the room. And then my favorite Karina story is when she was very, very pregnant. And I love it when my staff will frequently send me a message that says, Trish, you might get a call. Usually because they've done something like they're very much in their job description and is very appropriate, but they're giving me the heads up that somebody didn't like that staunch advocacy. And such occasion happened, as she said, you might get a call, Trish, and the next message is, and I'm like, what happened? And she said, well, the surveyors were in the building and the facility was not letting Karina get to them to tell them about some resident concerns. And they wouldn't even tell her where they were in the building. So she knew where they probably were. And as a very pregnant gal, was it 9 months? You were like 9 months pregnant. She knew the building and she could access it on the outside. So she climbed between some bushes and was knocking on the window. And I'm like, hey, I gotta talk to you. I gotta talk to you. So she's like, Trish, you're gonna get a call. And man, I came out of there, I had some scratches. And so, I mean, that is somebody who goes above and beyond. So I do want to thank Karina for her time with us and with the team. And I'm so glad you're with us the last 6 years, and you're wonderful. She's prepping for her daughter. She's actually on vacation this week and prepping for her daughter's quinceañera on Saturday. So we're very happy to have you.
Karina, would you like to say anything?
Well, I want to thank everyone here. I think at the end of the day, I love the environment, coworkers, every department I've been in. I think managers, everyone, supervisors have been great. And I think just, that any situation you hit in life, you have that support, you have that help. And no matter what, it's like, you kind of feel more like a family, not left alone. So I think that's what helped me stay here, all those 10 years, regardless, it's like a big, huge support system.
I think, first of all, amazing amount of credit goes to the management team, to Natasha and the managers for really creating that atmosphere where it really is a family. I mean, the seniors unit is they're so together. They're really, the managers are just, it comes from the way they work together, the way they respect each other, the way they, pitch in for each other. So like, that's such a reflection on their management style. The other thing I just wanted to point out from all three of these, I don't know if anybody else noticed, they all started in different positions. So, we do always try and give people professional development opportunities, ways to, increase their skills, increase their income. And I think it really people feel, rewarded and valued when they're given new opportunities. So again, that's also, managers hate to see a great person leave their department to go to another one, but nobody ever tries to block that. We really try to encourage people to, go improve your skills, improve your income, just get more professional development. So kudos again to that whole management team. That's
I'd like to open the floor to the board and then we'll do pictures. So any comments? Yeah, Member Glassy.
I mean, this is just, what a wonderful morning. The love and support in this room is so apparent. And to your point, Mary, I mean, it's obviously just the environment that you guys all foster. So congratulations to, top down. I mean, it's just, what a wonderful morning. So congratulations to all the three of you that were honored today, and really thank you for your service.
Member LaPlante.
Just want to know if you guys are hiring. Okay, this is nice to work.
Member Katie.
I just want to say thank you so much for your years of service. And I know in private practice that one of the key things to keep employees is the environment in which you work and the people that you work with. People will stay as long as possible if they love their environment and it becomes a family. And this is apparent based on the leadership of your team and coming from the top, Mary Keating. So thank you very much for your years of service. Hope to see you in 10 more years.
Member Garcia.
Just thank you so much for all of your work. We cannot tell you in as many words as been given already today how much we appreciate what you've done for all of our seniors, all of the people that you're involved with. And again, people on Zoom can't see how many people are here to support this group, but I'm telling you, it is amazing, and it's amazing to see the cooperation and the love given to all of you. And we are so grateful for everything you've done for the county. So thank you.
Member Dessart.
Oh my gosh, everything's already been said that needs to be said. Congratulations, ladies, on 10 years with DuPage County. And I echo what some of my colleagues have said, that it starts from the top down, and just building that culture of family and the culture that makes employees want to stay is really extraordinary. So congratulations to all. Thank you.
Thank you. And I'm just something extra I want to add is the work you guys do. Look, 10 years is a long time. I mean, think about where the world was 10 years ago. I mean, it was a long time ago, and things were a lot different. And I've told Mary Keating this, the work you guys do in community service, you guys save lives, and you may not see it, but you do. And so thank you to everyone in community services for all you do, because you do save lives of DuPage County residents. So thank you very much. And let's do. We'll have the recipients and the
Board members.
board members, and can we get the,
And we'll be on this wall, so if you are neither a recipient nor a board member, I would ask you to. And I'm gonna move this. Yeah.
I know, right?
You guys are up against the wall, and, if you could be in the middle, okay? Certainly because of your importance, but mostly because you're tall and you can talk to one.
Oh, yeah. I did.
Yeah, there we go.
Oh.
I'm gonna be here. We're all gonna look at me.
Don't cover your face. with
And yeah, flowers down a little later. Thank you.
Oh, thank you.
Oh my gosh,
Tons of. Okay, thank you, everybody.
Sorry about throwing your.
Thank you for everything.
Thank you, gentlemen.
You do all your hours.
I don't know what Yeah. You need 30 hours. You know, no.
Get their phone.
Yeah, I will send these to you right now, actually, Mary.
Okay, thank you all, and we are gonna move on to our agenda now. I will take a motion to approve FIR 16125.
So moved.
Acceptance and appropriation of the Illinois Association of Community Action Agencies Employment Barrier Reduction Pilot Program for program year 26. The amount of $40,250. Member Cahill motion and Member Garcia seconded. Any discussion? All in favor, say aye. Opposed? Okay. Take a motion on FIR 15525, acceptance and appropriation of the Aging Peace Coordination Unit Fund, program year 26 for senior services in the amount of $8,130,284.
Second.
Moved by Member Garcia, second by Member Cahill. Any discussion here? Just a quick question on this, Mary. So is this money coming from the federal government? What
This is state program year 2026.
Okay,
So,
state.
yeah, most of this comes from the state. This is really establishing the full senior services budget,
Okay,
most of which is fee for service through the case coordination program or the ombudsman, those kinds of things. So some of it will be federal, but most of it comes from Medicaid, right? Medicaid reimbursement.
is there potential that this could be affected with?
What would, I think the most likely impact would be a reduction in the number of people who are on Medicaid and then eligible for the program. But this is basically, this establishes the budget line. And we adjust the.
Where's on the mute?
We adjust the, we basically adjust our staffing and everything based on the caseload that we have. So it's not a case that we would overspend. We, we get reimbursed for what we actually perform.
Thank you very much. All in favor, say aye.
Aye.
Opposed? Okay. I'll take a motion on FIR 15725, acceptance of modification of funding allocation for the Illinois Home Weatherization Assistance Program, income eligible retrofits program for plan year 25, or total amount not to exceed $171,394.
Second.
Member Garcia, second by Member LaPlante. Any discussion? All in favor, say aye.
Aye.
Opposed? Thank you. I'll take a motion on FIR 15825, appropriation of additional funding for the low income home energy assistance program, HHS grant for program year 25. Going from $3,487,312 to $4,050,265, an increase of $562,953.
Second.
Any discussion here? All in favor?
I just said yay.
All in favor, say
Aye.
yay. I'll take a motion on HSP 4625, recommendation for the approval of a purchase order issued to WellSky Corporation for the annual renewal of the homeless management information system software and cloud services contract, renewal of licenses, training, support, and custom programming for community services for the period of November 1st, 25 through October 31st, 26, for a contract amount not to exceed $64,028.90.
Second.
Any discussion?
Yes, is this grant funded?
Yes.
Okay, thank you.
Any other? Okay, all in favor, say aye.
Aye.
Opposed? Okay, thank you. I'll take a motion on HSCO 125, amendment to county contract 72710001, serve issued to DuPage Federation on Human Services Reform Language Access Resource Center for interpretation, translation, and American Sign Language services, an increase of $8,500 for a contract total not to exceed $38,499. We did get them. Did we get a second?
Yep.
Okay, any discussion? All in favor, say aye.
Aye.
Opposed? Okay, thank you. I will take a motion on HSR 1725, approval of issuance of payments by DuPage County to energy assistance providers through the Low Income Home Energy Assistance Program, HHS grant for program year 25, intergovernmental agreement in the amount of $484,140.
Second.
Any discussion here? All in favor, say aye.
Aye.
Opposed? Thank you. I will take a motion on HSP 4725, recommendation for the approval of a contract purchase order issued to Pulmonary Exchange Limited for the rental of respiratory care equipment for the DuPage Care Center for the period of November 20th, 2025 through November 19th, 2026, for a total contract not to exceed $35,000.
Second.
Any discussion?
Any idea about purchasing versus rental?
Turn it to Janai.
Yeah, so, we do own, quite a bit of our oxygen concentrators. And that is, much cheaper for us to own them versus to rent them.
It's cheaper to rent it than own it.
No, it's cheaper to own it
Okay.
than rent it. And
Okay.
this isn't just equipment, this is, respiratory care services, so I have a respiratory
Okay,
therapist.
that's what I meant. This is services. Okay.
Services and some equipment.
It says
Rental,
of
I know, but
equipment.
those are odd ends, so like our
Okay.
oxygen concentrators we own, but if somebody
Good.
has a particular BiPAP, CPAP, or something like that.
No, that's what I knew that it was cheaper to own versus rent. That's why I brought up the question. Okay, thank you.
Mhm.
Okay, thank you, Member Cahill. Any other questions? All in favor, say aye.
Aye.
Opposed? Okay, thank you. Take a motion on HSP 4825, recommendation for the approval of a contract purchase order to HD Supplying to provide housekeeping and cleaning chemicals as needed for the DuPage Care Center for the period November 1, 2025 through October 31st, 2028, for a total contract amount not to exceed $189,000.
Second.
Any discussion? All in favor, say aye.
Aye.
Opposed? Thank you. I'll take a motion on HSP 4925, recommendation for the approval of a contract purchase order to Point Click Care Technologies for software maintenance for the DuPage Care Center for the period December 1st, 2025 through November 30th, 2026, for a total contract amount not to exceed $302,734.83. Bless you.
Thank you.
Did we get a second?
Second.
Thank you. Any discussion? All in favor, say aye.
Aye.
Opposed? Okay, thank you. Take a motion on 25-2392, recommendation for the approval of a contract purchase order to Activity Solutions LLC to furnish, install, program, and test cameras for the DuPage Care Center for the period October 8, 25 through October 7, 26, for a contract total amount not to exceed $26,270.20.
So move.
Second.
Any discussion here? Yeah, Member Garcia.
Just one quick question, on this. How many cameras are already there and what will this be in addition to?
You know what, security is really taking on this project for
Okay.
us, so I can't tell you. We have many cameras, but we have a lot of underserved areas that
Right.
we are asked for some additional.
So this will cover that area then?
Yeah.
Okay, perfect. Yep, thank you.
Thank you. Member Garcia, any other questions? We'll do a roll call, please.
Member Garcia,
Aye.
member Desart,
Aye.
member Galassi.
Aye.
Member LaPlante,
Aye.
member Cahill. Aye. Chair Swarzy.
Aye. Thank you very much. On the informational items, I'll take a motion on FMP 4625, recommendation for the approval of a contract to City of Wheaton for water utility services for the county campus for facilities management for the period October 1st, 25 through September 30th, 29, for a total contract amount not to exceed $3,152,000, in which 412 is for the DuPage Care Center.
So moved. Second.
Discussion? All in favor, say aye.
Aye.
Opposed? Thank you. Take a motion on FMP 4725, recommendation for the approval of a contract to Wheaton Sanitary District for sanitary sewer utility services for the county campus for facilities management for the period October 1, 25 through September 30th, 29, for a total contract amount not to exceed $1,821,000, in which $281,000 is for the DuPage Care Center.
So move.
Second.
Any discussion here? All in favor, say aye.
Aye.
Opposed? Thank you very much, everybody. Okay, we do not have any residency waivers, so we'll turn it over to Janelle for our Page Care Center update.
All right. Good morning, everybody. Construction update, we're still working on 2 north, 2 center, 2 south. They're moving along. Hopefully in the next 30 days, we'll be talking about finishing those areas up and then waiting. With the government shutdown, that stops any process of review for architect or construction approvals. So hopefully that doesn't last too long. We're in a good window right now in relation to that. We just had our annual survey and the health side is complete before the shutdown. The life safety code side did come in and survey, and we're in the process of submitting everything to them that will not be reviewed until they come back into the office. But we had a really good survey on the health side. This is one of the first times we really had no deficiencies related to the care provided by the CNAs. So infection control, wearing the right glove, gown, stopping and, changing gloves at certain intervals between clean and dirty process. So just a great shout out to the CNAs for all their hard work and the staff as a whole. It's a really good survey, so. And then I have a letter I'd like to read, if I could, please. We get these, but sometimes it's nice just to share. So, dear Ms. Chadwick, I'd like to extend my deepest gratitude to you and your entire team on One East. The team's professionalism, compassion, and dedication made a difficult time much less stressful. I felt my loved one, Michael, was truly cared for by all departments. I've been a nurse for 50+ years, and Mike was a physician. I know what excellent care looks like. Dr. Bourne assured us that your facility was good, and he was right. Mike in social services, you can't hear them. Went the extra mile to help me in making difficult decisions. He works well with other team members. Ashley on One East is well-informed, kind, and was consistently very helpful. The techs, Luz, Neelam, and Marisol were hardworking and caring with each interaction with Mike. The therapist, Sue and Susie, were knowledgeable and were always striving for the best outcomes for Mike. All staff members we encountered were excellent. Thank you for all you do. You really do make a difference in people's lives, with sincere appreciations.
Sounds good.
Is he still with us?
He's short stay for rehab.
I was thinking the past tense. I didn't understand.
Yeah, yep.
And that came from a longtime nurse, and the
Yes,
patient is a longtime physician.
Yes, yep.
That's quite the recognition.
It
So
is.
very good.
it
Thank
is.
you.
Thank you.
Any other questions for Janelle? Okay, thank you very much. Oh, one
Yes.
question for me.
Yep.
So with the construction and the federal government shutdown, I didn't realize this was a federal government sort of thing. I thought it was more of a state.
So surveyors were ordered out of any building, the state surveyors, because they're doing a Medicare survey as well as a Medicaid survey. So anyone that has funding for Medicare, Medicaid,
Gotcha.
ceases.
Okay.
So they did put a memo out, if you're a straight Medicaid facility, they could still come in for the next like 30 days. It's not a quarterly cycle, but not for
Okay.
any duly certified people like us.
Thank you very
Yep.
much. Okay, community services update, Mary Katie.
Okay, well, we had such a uplifting beginning to the meeting. Now I'm just gonna bring us like. I do have a piece of good news that I'll close with. Just an update on the government shutdown. So, obviously it continues the uncertainty about what's gonna happen in 2026. But in terms, and most of our programs are operating on 2025 money. We're drawing funds, we're fine, but there are a couple of things that are currently delayed. The Full Circle Communities project in Glen Ellen, it's a really important project for Glen Ellen. There's a couple of different sources of funds. We're waiting on what's called it's the release of funds. That's authorization to use grant funds. We're waiting on HUD to sign off. Unfortunately, the 15-day comment period closed on September 30th. And so typically it would have been signed on October 1st. So until HUD staff are back in the office, we won't be able to get that release of funds, which means, and then it's just a domino effect. It means then Glen Ellen can't move forward with the demolition, which means they can't move forward with the closing on the property, which means they can't access the tax credits, which have a deadline. Yeah, hopefully, the shutdown won't be so long that it will really jeopardize that project. We also have some environmental reviews that can't be completed for our neighborhood investment projects, for CDBG projects, for 2025 money. Most of them, if not all of them, wouldn't have started this fall anyway. The construction season, sort of coming to a close anyway. So, but it still means that we're on hold. There is some, as I've talked about before, the county we serve as the lead agency for the homeless continuum of care. There's about $8.6 million that comes from HUD to various agencies in the county. So we sort of coordinate the application. We serve as the planning organization. We run the homeless management information system. But the vast majority of the money goes to organizations like PADS, Catholic Charities, Midwest Shelter for Homeless Veterans, 360 Youth. I think those are the four agencies that, with PADS and Catholic Charities being the largest recipients. So last year, in the last year of the Biden administration, they had committed that the grants would be for a 2-year program. So there would be basically a non-competitive renewal. So it'd be a 1-year grant, then there would be a non-competitive renewal for the second year. Earlier this summer, the HUD announced that no, they would not be doing the automatic renewal. There would be a requirement to reapply. And there was some discussion about what changes might be made. And so nothing has come out officially because obviously HUD staff aren't working right now. So, but some of the things that they are talking about for the new program is a significant reduction in the percentage of your programs that can be for permanent supportive housing. So permanent supportive housing in this context is for folks who have a disability and have been chronically homeless. And permanent supportive housing means just that, like they can stay for as long as they need to or want to.
They're reducing that?
They're reducing the percentage of your total that can be used for permanent supportive housing, because you can do permanent supportive housing, you can do rapid rehousing, which is basically short-term, someone who is currently homeless, you help them get into a unit. Then there's some short-term case management or sort of transitional housing. You can do street outreach with it, but they're talking about reducing the percentage. Now, currently in DuPage, about 56% of our $8.6 million is used for permanent supportive housing. There's about 620 people who are in permanent supportive housing, typically mostly through PADS, Catholic Charities, and Midwest Shelter. In some places, they're doing 100% of their continuum funds are permanent supportive housing. There's been discussion, it's maybe only 70% of your total can be PSH, maybe 50%, maybe 30%. So no numbers have been issued, but it's making folks fairly concerned about, well, what happens if we have 56%. What if it is 50? People are literally going to be displaced. The other thing that they're talking about is, an evidence-based practice called Housing First allows folks to move into housing that's funded through continuum of care funds and not be required to engage in services. And the evidence very clearly shows that people really need to have stable housing before they can address their other issues, like mental illness, substance abuse, those kinds of things. And so sometimes it can take time for folks to get engaged in services. There is discussion that that will no longer be allowed, that engagement in services will be mandatory from day one for these programs. That's a big change and one that will be very challenging for agencies to adopt. Like I said, there's been no discussion, or there's been no official release. There's a lot of advocacy going on, trying to get members of the House and Senate Transportation, Housing, and Urban Development subcommittees to agree. And I think what advocates are saying is, we understand that the administration can change the priorities. That's certainly within their prerogative. But could you just do the 2-year renewal so we have time and we know what's coming? Because one of the things they've been doing recently is issuing these notices of funding opportunities. Typically, you would have 2 or 3 months to respond, and particularly if there's significant changes. There was one recently that was given you were given 7 days to respond. And it was a complete change in the priorities of the program. And so I think people are really nervous about, will there be a quick turnaround time? Will there be these massive changes? So if there, basically the advocacy piece is, please just renew, and then we're happy to sit and really talk about changing priorities. That's totally fine. Okay, so that's my really depressing.
Can I ask a quick question?
Yeah.
Do they, I mean, this is it HUD, do they give a reason that they are considering reducing the permanent supporting housing? What?
I haven't seen anything in writing. I think the thought is folks need to get to work or get, somehow access other resources to allow them to become more self-sufficient.
But many cannot work. I know we all know this, but I know. I'm speaking like that.
Better.
So the better news is the Alden Horizon, the new senior building in Addison.
Addison, sure.
Is they are in the process of leasing up. There's going to be a ribbon cutting. You'll all get an invitation to it. I haven't seen the date yet. It's going to be sometime in early November. So I thought I'd end on a positive.
Thank you, Mary. Yeah. Any questions for Mary? Just thank you for your expertise. I mean, you bring stuff to us that's so valuable to know, and we may not even know to look for it if it weren't for you bringing it to us. So
well, a lot of that is, a lot of that is staff alerting me, getting insights from she's our homeless continuum planner. She's really on top of things, and, she's the one who taps me on the shoulder virtually and says, hey, you might want to be on this call, or here's something going on. So
please thank all your staff for us. So. Okay, do we have any old business? Seeing none, do we have any new business? Okay, without objection, we're adjourned. Thank you, everybody.